as I described in last lecture. What is the osteology? Review of the structural organizations, body systems. Many systems in the human body are involved. First of all, skeletal system. Skeletal system describes the bones of the human body and its structure, development and movements. Next, circulatory system. Circulatory system is related to heart and artery and veins of the human body. Next, digestive system. Digestive system is related to oral cavity, to rectum. Just we take food and digest and metabolize, and after all excreta of the body excrete out from rectum. Next is respiratory system. In this respiratory system, it starts from nose or nasopharynx, trachea, bronchus and both lungs. We inspire air in the lungs and expel out the air. Next, urinary system. Urinary system is related to both kidneys, left kidney and right kidney, and ureter and urethra. Urinary system involve different parts. Next is reproductive system. Reproductive system is our body's important system. Next is nervous system. Nervous system reveals in many nerves in the body and autonomous nervous system. Next is muscular system. This involves in all the muscles of the human body. And next is endocrine system. And in endocrine system, many glands are involved in the human body. Just for example, we can take thyroid gland. Thyroid glands secrete thyroxine, etc. And next is augmentary system. Augmentary system reveals many functions of the body. Now here described only skeletal system. Much general diagnostic radiography involves examination of bones and joints, osteology, arthrology. 206 bones separates, divided into two parts. Number 1 axial, number 2 appendicular. Axial skeletal system having 80 bones. First of all, this is the cranium. It has 8 bones. Facial bones. Next facial bones 14 and hide bone 1. In this skull, auditory ossicles are 6. This is the part where ossicles reside. Cervical ribs, cervical vertebrae are 7. Those makes our spinal cord. Lumbar vertebrae are 5. One is sacrum. This is the sacrum and anterior part, and the posterior. This is the posterior part of the sacrum. And this is the coccyx. 12 pairs or 24 ribs are in human body. This make cage our chest. In this chest, left side, our heart is situated. Heartbeat is situated in the 4th intercostal space of the ribs. In some time, about 10,000, in the person of 10,000 quantity, one can be dextrocardia. Dextrocardia means the heart could be in right chest of the thoracic cage. This called dextrocardia. Normal physiological functions and anatomically left side heart is designed in left side only, but in some cases it can be in right side. This is dextrocardia. Appendicular skeleton have 126 bones, 2 clavicles. This is the clavicle, and this is the sternal end of the clavicle, is the distal end of the clavicle, acromial process, and anterior part, posterior part. This the S shape. Both two-sided are here. This called also clavicle or collarbone. One this side and another this side. This makes the shoulder joints with the help of humerus. 2 humeri are in the forearm, 1 in left arm and 1 in right arm. 2 ulna and 2 radius. This is the radius, and this is anatomically, this is situated in the right side of the body, and ulna is in medial part, and radius is in outer or lateral part. Carpus 16, metacarpus 10, phalanges 28, hip bones are 2. We can show this is the hip bone, this is the pubis symphysis, this irregular bone. 2 bones are situated in both sided, 1 in left side and 1 in right side. This is known as hip bone. This has 3 parts: rami, pubis symphysis, and etc. Tibia, fibula, both sided, fibula are also both sided, 2 patella, tibia, fibula. This is the femur bone. This makes a joint to make, this is the hip joint, and next is femur, and after femur this is the patella in between femur and tibia fibula. These are the tibia fibula in the leg, in left and right. 14 tarsals, metatarsals 10, and 28 phalanges. Sesamoid bone, especially oval-shaped bones found in tendons, mostly near joints, not present in developing fetus. The only sesamoid bones that are included in the total body bone count are the patellae, commonly found on the palmar surface of the hand, sometimes in tendon of the other hand, upper of lower limb joints. Any sesamoid can be fractured and may need to be demonstrated radiographically. Bones classification. Bone are of 4 types. 1 long bones, this is long bone. 1 short bones, this is the short bone. Number 3 flat bones, this is the flat bone, sternum, and other irregular bone. Long bones have 1 body, 2 ends. This is the upper end and this lower end, composed of compact bone or cortex body. Spongy bones, red marrow, medullary cavity, periosteum, hyaline cartilage. This is the hyaline cartilage attached in the body of this bone, articular cartilage and periosteum. Periosteum is the outer covering of this bone. Flat bones consists of two plates of compact bones with the cancellous bones and marrow between them. Example: clavarium, sternum, ribs and scapulae. Scapulae is also a flat bone. This is the costal area and this is the posterior area. This is rami, coracobrachialis, and this is situated in the back part of the human body. This is the back portion. This is the inferior angle, superior angle, medial border, and this is the lateral border of this bone. Diploid space between the inner and other table of the flat bones in the cranium. Irregular bones with peculiar shapes: vertebrae, facial bones, bones of the cranium base and bones of the pelvis. This is the bone of pelvis. This is irregular bone. This is bone of pelvis. Two bones in both sided are situated. This is in below the trunk and make hip joint with the help of this femur. This is the joint, socket elbow joint, ball and socket joint moves femur, surgical neck, greater trochanter, and this is the lesser trochanter, and this is the lower end of this bone. Blood cells productions: RBC, red blood cells, are produced in the red bone marrow of the certain flat and irregular bones. Flat bones is this is the sternum. This is flat bone. In this bone, red bone marrow of certain flats and irregular bones. This produce red blood cells. Bone development. Ossification begins in the 6th embryonic week and continues until adulthood. Two kinds of bones formations: intramembranous occurs rapidly in bones necessary for protection. Sutures of the skull. We can see the suture of the skull. This is the suture of the skull. This is the occipital part of this bone. This is suture of this bone. Endochondrial, much slower than intramembranous, occurs in most part of the skeleton. Center of endochondral ossification: primary centers, mid-body or diaphysis. Secondary center, ends of the extremities of the long bones of epiphysis. Epiphyseal plates found between the diaphysis and epiphysis until skeletal growth is complete. Arthology or study of joints. Functional classification: synthenosis, immovable joints. This is the immovable joints: sternum and clavicle. This is the sternal end. Sternum and clavicle is the immovable joint. Immovable joint. Affray, arthritis, limited movements. Limited movements joint is just this is the limit of this movement. Arthrosis, freely movable joints. This is the freely movable joint. We can move in this direction and otherwise in this direction. This is freely movable joints. Structure classification: syndesmosis, sutures, gomphosis, cartilaginous, had highly together cartilage, symphysis, example in the intervertebral disc, amphiarthroidal. Synovial fibrous capsule contain synovial fluid. They are diarthroidal, and some example are knee joint and elbow joint. This is the knee joint and this is elbow joint. This is known as synovial joints. Movements, types of synovial joints. Synovial joints have 6 movements. Number 1, plating or gliding, gingimus or hinge, trochoid or pivot, ellipsoid or condyle, sellar or saddle, sphenoid or ball and socket joint. Body planes, sections and lines. Sagittal plane, any longitudinal plane divided in the body into the right and left part. Sagittal plane is divided body into 2 right and left parts. Mid-sagittal means body is divided in just in midpoint in right and left part. Coronal section is the longitudinal plane divided into the body into anterior and posterior parts. This is the anterior part of the body, and this is, if we cut here, and left part is the posterior part. This is the coronal section. Mid coronal divided body into the equal anterior and posterior parts. Mid coronal section means just between exactly midpoints, anterior point and most part of the left posterior point. Horizontal axis plane, transverse plane passing through the body at right angle. Transverse section parts at this level just 90-degree angle. Divided into superior and inferior portions. This is the superior portion and this is the inferior portion. Superior means upper portion and inferior means lower portion. Oblique plane, longitudinal or transverse, that is on an angle or slant to sagittal, coronal or horizontal planes. Body surfaces and part. Posterior or dorsal part. Posterior part, this is the, my back is the posterior part or dorsal part, and anterior part is the chest in front of me. This can be called ventral part. Plantar part means sole of the foot. Dorsal part, top of the surface of the foot. Dorsal parts means we can show the palm, so upper side of the palm. Palm of the hand, this is the palm of the hand or anterior or ventral portion. This is the palmar side and this is the ventral surface. Body positions and special projections. Supine position, prone position, and this is the erect position, recumbent position, triangular Fowler's Sims lithotomy, in which patient bends his left arm, knee to the chest and right leg relaxed. Classification of position in terms. Position used when indicating the patient's general physical position such as supine, prone. It is also used to describe specific body positions such as the oblique, laterals. Restricted use of the word of the patient's physical position. Projections describe the path or direction of the central ray. restricted the use of this word of shear, weave. Not a correct position. Terms in the US restricted the use of word weave to describe the image from the vantage of the image receptor. An introduction to osteology or skeletal system. Osteology is the scientific study of bones, a discipline of anthropology and archaeology. Osteology is a detailed study of the structure of bones, skeletal elements, teeth, morphology, functions, diseases, pathology, the process of ossification from cartilaginous mold, the resistance and hardness of the body by phases, etc. Often used by the scientists with identification of human remains with regard to age, death, sex, growth and development in a biocultural context. This is very important to describe the age with bone, death and sex determination with the bone, growth and development of the human skeleton. A typical analysis will include an inventory of the skeletal elements present, a dental inventory, aging data based upon the epiphysis fusion, and dental eruption for subadults, deterioration of pubic symphysis or external end of the ribs for adult. Stature and other metric data. Functions of the bones. End part of the bone makes joint from the help of the cartilage, tendons and muscles, and it provides a shape to the body. Some bones of the body protects the vital organ of the body, as bones of the skull protect the brain to form a cavity. Vertebral column protect spinal cord. We can see the skull of the human body. Brain is descend here. The skull prevent brain from exterior shocks, injuries and accidents. Vertebral column protects spinal cord. We can see the vertebral column, these are vertebrae, and this is the area in which spinal cord remains from this occiput to this part of the sacrum. In this area, in this passage, spinal cord is descended, and these bones are protect from injuries and other infections and etc. Some bones of the help of the viscera forms a cavity, as muscles of the face forms the orbital fossa to protect the eyeball. For example, we can say the skull twice. This is the orbital fossa. The eyeball is descend here. Both eyeballs are safe in this orbital fossa of this skull. To protect eyeball, this contains sophisticated muscles and tendons to move the eyeball. This is provided surface to the muscles, tendons and ligaments, etc. Some bones help in the movement of organs, as auditory ossicles. In the function of production of voice and singing. Bone marrow is the contained matter of the bone in which blood cells production is an important function. % of the total body Calcium and phosphorus is present in the bones with the help, next point, with the help of air sinuses. It helps the skull, makes weightless and easily movable, and also provide voice clarity. In the bone marrow, reticuloendothelial cells are present and provided protection in the form of immunity. Vertebral column protect the spinal cord. External union of the bones makes joints of the skeleton. This provided a frame to the human body. Now let us start general functions of the skeletal system. The skeletal system is responsible for the movement of the body, as it has the basic functions of the bones and muscles. The main function of the skeletal system has the support, protection, blood cells protection, movements, mineral storage. The skeletal system provides the support to entire body parts and for all important functions of the body movements. For example, the cranium protects the brain, ribs protect the heart and lungs, pelvis protects the digestive system and also reproductive system organ. Totally there are 206 bones are present in the human skeletal system and they are well protected. These movements are supported by the ligaments and tendons. For convenience part, the skeletal system has been divided into axial skeleton, stem and appendicular skeletal system. The longest bone in the body is situated in thigh region and smallest bone in the ear part. Longest bone of human body is femur, and this is the head of the femur, and this is the surgical neck of the bone. Mostly in the older ages, cervical neck fracture is very common. The longest bone of the body is situated in the thigh. The bone is in, and little bone is stapes. Bones are having the different types based on the density of the intensity of the bone mass. Accordingly, the axial skeletal system is responsible for skull, sternum, ribs and vertebrae column, vertebral column, whereas the appendicular system is for upper extremities and pelvis. Two types of bones. There are axial and appendicular bones. These appendages and arms and legs, which contains approximately 30 bones each. There are typical 22 bones in head. There are 33 bones in the spine, and these includes two type of bones. There are axial and appendicular bones. The appendicular bones are arms and legs. Appendicular bones are in arms and legs, which contains approximately 30 bones each. There are typically 22 bones in head. This is the skull. In this contains 22 bones. There are 33 bones in the spine. These include 7 cervical necks, 12 thoracic and 7 lumbar, 7 pairs true ribs directly to the sternum, breast bones, 3 pairs of false ribs joined to the sternum, breast bones by the cartilage, 2 pairs of the ribs, these are the ribs. 2 pair of the lower side are floating ribs. 3 pairs false joints, 2 pair floating, and the shoulder girdle consists the scapula and shoulder blade. The clavicle is known as collarbone. This is the clavicle. This is the part of acromial process. This is sternal end, and this is the anterior border. This is the posterior notch, and this is acromial part connected to the humerus. The following summarize the 5 main categories of the bones together with the another category. Long bones. Long bones have greater than width and they consist of the shaft and a variable number of ending extremities. They are usually somewhat curved for strength. Example including femur, and this is the tibia and fibula, and these are the radius and ulna. Radius is the situated in the outer side or thumb side of the arm. Short bones are roughly cubed shaped and have approximately equal length and width. Example including ankle and wrist joints. Flat bones have a thin shape, structure and provided considerable mechanical protection and extension surface for muscular attachment. Example in cranial bones. Protecting the brain and sternum, ribs, protecting the organs in thorax and scapulae, shoulder blades. Irregular bones have complicated shapes and so cannot be classified into any of the above shape-based category. Their shapes are due to the functions they fulfill within the body. Example, providing major and mechanical support for the body, yet also protecting the spinal cord. In the case of the vertebrae, example include the vertebrae and some facial bones. Sesamoid bones develop in some tendons in locations where there is considerable friction, tension, physical stress. They may therefore form in the palms of the hands and soles of the feet. However, their presence and quality varies considerably from person to person. Example common to the everyone include the patella, kneecap. Sutural bones. Sutural bones are classified by their location rather than by their shape. They are very small bones located within the sutural joints between the cranial bones. The number of sutural bones varies considerably from person to person. Therefore, these are unnamed bones. Anatomy means to cut the structure and study. This study is the scientific study. Basic concept of anatomy. Definition: human anatomy, the oldest science dealing with the structures and functions of the body. Gross anatomy, systematic anatomy, regional anatomy, applied anatomy, and clinical anatomy. Hippocrates is that great person which known as the father of medicine. In 460 to 377 BC, he works and start a school of medicine and teach the students in a regular manner. In entire world, only that Hippocrates is great person Hippocratic oath is valid throughout the world. And next, Galen 130 to 200 BC. Galen is also a great scientist of ancient era. He works in various manners for human body and human science and promotion of the health. Vesalius is also a scientist in ancient era. He was in 1540 to 1564 and works for betterment of human and describe the human body and describe the structure of the human body. He has a great role in the anatomy. Harvey. We know the William Harvey. William Harvey was in 1572 to 1657. William Harvey is that person. This describe the circulatory system of heart and veins and arteries, differentiation of the arteries and veins in the heart. Descriptive anatomical terms. The body is upright, legs together and directed forward. The palms are turned forward with the thumbs laterally. We can see the anatomical position: face erected forward, palms, these palms are straight and thumbs are laterally. Both legs are directed forward. This is the anatomical position of human body. Terms of directions: superior, inferior. This is the superior position, or we can say the superior position of collarbone and inferior position of collarbone this side, anterior and ventral. Chest and trunk is the ventral or anterior position, and back is posterior or dorsal position. Medial is the in the center, and lateral side is distant from center. Internal and external. Internal means within the body, and external outside the body. Superficial and profound. Superficial means this is the superficial position, and profound position next side. Proximal means nearest to the body, and distal is the distant from center of the body. Ulnar side means this is the ulna and this is the radius. Ulnar side means inner side, and radial side is the outer side at the side of thumb. And tibial and fibular. Tibia is the lateral side and fibula is in the medial side of the body. Anatomical axes and planes. Axis: vertical axis, sagittal axis and coronal axis. Planes: sagittal planes, coronal planes, horizontal planes and transverse planes. This is the transverse planes, horizontal planes and coronal planes and sagittal planes. Locomotor system. Bones, joints and muscles are involved in locomotor system. Locomotor system supports of the body and protection of the body and locomotion. Locomotion means are the motions of the body, thumb forward and backward. This is the locomotor system's involvement. Thanks. Introduction of the osteology. Bones in adults are 206 in number. Classification of bones. Bones are classified according to their position and shape. The position can be skull, bone of the trunks, appendicular skeleton, types of shape including long bones, short bones, flat bones, irregular bones, and this is the upper limb, osteology of the upper limb. Diaphysis. In upper limb, first of all we can describe the humerus. This is the upper part of the humerus. This is descended in scapula, olecranon process. This makes the shoulder joints, and this is the lower end of the humerus, and this is shaft, which is hollow and called medullary cavity filled with bone marrow. Two ends, epiphysis, articular surface, metaphysis, epiphyseal cartilage, and epiphyseal lines. This is the surgical neck. These are greater trochanter, and this is the lesser trochanter of the bone, and this is the surgical notch. This is the linea aspera, and this is the lower end. In this lower end, olecranon process is here, in which ulnar part is attached in inner side, and radius is attached in outer side of the bone. Flat bones, thin, irregular, have an irregular or mixed shape as vertebrae. Pneumatic bones, sesamoid bones develop within tendons. This is the irregular bones. This is the body or disc. This the medullary canal, anterior process, lateral process. This makes fixed joints and irregular vertebrae. These are the pneumatic bones. Sesamoid bones develop within tendons. Structure of the bones. Bones substances: compact bone, spongy bone, tubercle. In the flat bones of the skull, the layer of the compact bone are called the outer plate and the inner plate, while the layer of the spongy bone is called diploe. Periosteum. Outer fibrous layer is called periosteum. Inner layer is the vascular layer and provide the underlying bone with nutrition. It is also contains osteoblast cells. Endosteum is a single cellular osteogenic layer lining the inner surface of the bone. Bone marrow, red marrow, hemopoietic system, yellow marrow, and fatty acid. Chemical composition of physical properties: organic material, inorganic salts. In children, organic material in ratio of 1, inorganic salts in also ratio of 1 and 1. In adults, organic material in 3 and inorganic salts are in ratio of 7. In old age, organic material in ratio of 1 and inorganic salts in the ratio of 4. Bones of trunk composition of vertebrae: sacrum, coccyx, and sternum and ribs. Bones of trunks. Bones of trunks are this is the upper limb atlas vertebrae, and this is the another vertebrae, and the lumbar vertebrae, and this is the sacrum, coccyx, and these are the ribs. This is the anterior part, the upper border and lower border of the rib. In this rib, three main structures are descend. Number one, vein. Number two, artery. Number three, nerve. Three main structures are saved by the rib. Number one, vein. Number two, artery. Number three, nerve. These three structures saved by the ribs. There are 33 vertebrae in the children, arranged as follows: cervical vertebrae 7, thoracic. Cervical vertebrae are from neck to chest. These are 7. Thoracic vertebrae make thoracic cage. These are 12. Lumbar vertebrae are in this portion. These are 5. Sacral vertebrae are 5 in sacrum. Coccygeal vertebrae 3 to 4 coccyx. General features of the vertebrae: vertebral body and vertebral notch, pedicels of the vertebrae, vertebral arch, superior and inferior vertebral notch, lamina of the vertebral arch. This is the lamina of the vertebra of the arch. Spinous processes, transverse processes, superior and inferior articular surfaces. This is the superior articular surface. This is the superior articular surface, and that is the inner or inferior articular surface. Vertebral foramen. This is the vertebral foramen in which vertebral column or bone marrow descend. Vertebral canal. This makes a long canal known as vertebral canal. Vertebral foramen. This is the vertebral foramen. Regional variation of the vertebrae. Vertebrae body small, vertebral foramen large and triangular. Vertebral foramen are large and triangular. Spinous processes short and bifid in C3 and C4, long in C6 and long in C7. Transverse processes short and bifid, transverse foramen. Articular processes. Articular processes are the horizontal processes. This is the C1 or typical vertebrae or atlas. Body and spinous process absent. There is no process. Consists of anterior and posterior arches, anterior arch and posterior arch, and two lateral masses. These are the two lateral masses. Groove from vertebral artery. These are the groove for vertebral arteries. This has the area when vertebral arches pass. Axis. Distinguished by dens and which articulates with the dental fovea of the anterior arch of atlas. Anterior tubercle of the transverse process of the C6. Vertebral prominences. Contains long and non-bifid spinous process. It is visible with neck This is the neck of this bone. Flags used as clinical landmark in counting cervical and thoracic spinous processes. Thoracic vertebrae, heart shape, superior and inferior costal foci, vertebral foramen. This has vertebral foramen, a smaller, rounder spinous process. This is the spinous process. Long, pointed, obliquely downward transverse process, transverse costal fovea, articular process, coronal. Lumbar vertebrae, large kidney-shaped vertebral foramen, large and triangular spinous process project horizontally, transverse process long, articular process sagittal. Sacrum. This is the sacrum, and this is the anterior surface of the sacrum. Prominentary anterior sacral foramen, 4 pairs. These are the 4 pairs, 1, 2, 3, 4 pairs in both sides. Known as anterior foramen, medial sacral crest, posterior sacral foramen. These are the posterior sacral foramen. These are also 4 pairs. Sacral hiatus. This is the sacral hiatus. Cornea, lateral part, articulate surfaces. Sacral tuberosity. These are the sacral tuberosity. And this is the coccyx of the sacrum. Sternum manubrani, jugular knot, clavicular knot, body of the sternum, Zephyte process, sternal angle, the junction of manubrostine and body which connects second costal cartilage laterally and lies opposite lower border of the T4 posteriorly. This is the sternum. This is the notch of the sternum. This is clavicular notch. Clavicle attached with the sternum. Body of the sternum. This is the body of the sternum. This is the Zephyte process. This is the sternal angle. The conjunction of manubrum sterni and body which connects second costal cartilage and laterally the lies opposite lower border of the T4 posteriorly. Sternal angle. In the third vertebrae, this is the sternal angle which connects second costal cartilage laterally and lies opposite lower border of the T4 posteriorly. This is sternal angle, sternum and second costal cartilage laterally. 12 pairs of ribs are present in human body. This makes cage or chest of the body for the safety of hearts, liver, lungs and many other structures. General features. Ribs are 12 in pair. General features. Rib 1 to 7 called true ribs, 8 to 10 called false ribs, and 11 to 12 called the floating ribs. Floating ribs are that ribs which are not connected to the sternum in front but connected with the thoracic cage or spinal cord. These are they are the descended two vertebrae 2 ribs are floating ribs. Characteristic of typical ribs. Characteristic of typical rib: posterior end, costal head, costal neck, costal tubercle, shaft, costal angle and costal groove, anterior end. We can say this is the typical rib. This is the posterior end, costal head, neck and costal tubercle. This is the shaft, costal angle, costal grooves, anterior end, and this is curved. In the lower part of this rib, 3 structures are protected or saved, which is vein, artery and nerves. Mostly, or we can say the very important structures, vein, artery and nerves, are saved by the ribs, and overall it makes the chest or cage of the body. Let us start typical rib. First rib, tubercle for scalenus anterior, sulcus for subclavian artery and veins. 11th and 12th ribs, leg, costal neck, tubercle and angles. This is the first or atypical rib. Scalenus anterior is the part, sulcus for subclavian artery and veins. 11th and 12th ribs are leg, costal neck, tubercles and angles.